We're going to talk a bunch about the prodromal stage. When motor symptoms appear, though, you can estimate that Parkinson's started 10 to 15 years earlier. Here's Dr. Bayen with more.
As I told my patients, I tell them like this: prodromal stage of PD is a bit like a plant growing under earth, and so just not visible, but we have to treat at earliest possible to preserve autonomy and the mobility and life, the quality of life.
Prodromal symptoms include constipation, sleep disturbance, depression, even trouble with urgent urination. Taken apart, these are unique discomforts, and taken together, they start to look like Parkinson's. The problem is that we don't often take them together. Sometimes we're not honest with our primary care physicians. Sometimes we're just not really thinking about these various discomforts as something worth bringing up. But importantly, the earlier you start treating Parkinson's, the slower the symptoms progress. Yet most people with Parkinson's don't receive a diagnosis until motor symptoms appear. The motor symptoms might be things like facial stiffness, changes in handwriting, the telltale tremor, balance changes, maybe shuffling. You're shuffling your feet when you walk, or your loved one starts to notice that you're a little off balance, maybe some falls trigger a visit to the doctor's office. As Dr. Bayen began treating more people with Parkinson's and learning more about the disease, she started to realize that the existing diagnosis process was a major loss for her patients. Those prodromal symptoms that we talked about, constipation, emotional changes, sleep disturbances, were not getting reported or viewed as Parkinson's. And so it took until there was a fall or until there was a tremor to really get some attention just to begin the process. So this is a direct quote again: if all these people with motor symptoms have had Parkinson's for 10 to 15 years, this is a loss of opportunity for them, says Dr. Bayen. She began to ask her own Parkinson's patients, what was the start? Through these discussions, patients would start to mention things like, oh, I had these memory problems. Oh, I've had constipation all my life. Oh, I've had some really bad nightmares. Dr. Bayen decided to expand the research beyond her own practice and to kind of estimate and objectifies these delays, to figure out really what's going on outside of the anecdotal, what is actually happening in the average doctor's office to get a diagnosis of Parkinson's. The research team produced a survey looking into when patients reported symptoms, when the PCP began to suspect Parkinson's, and when the patient was referred to a specialist.
And so we had finally 51 patient files completely included, like a calendar. It was tricky to analyze these numbers because it was all of dates. And it was tricky because sometimes people already had another GP before or changed GPs, and then we had some negative values, but it is always explained in the article. So for the fans of numbers, they can read it in the article. But this is really, it was really pragmatic. And then I was really shocked about these delays.